the resource argument is fallacious. It is as simple as that. It just simply isn't true. The resources have increased. At the very least, we should be doing much better than we were 10, 15 years ago, but we're simply not.
What risk does the proposed national health insurance policy pose to South Africa's healthcare system? I posed this question to Mike Settas of the Free Market Foundation in a recent episode of my podcast. What follows is a short extract from a longer conversation. You can watch the full-length discussion by clicking on the link in the description below. Enjoy. So, Finance Minister Enoch Godongwana delivered his medium-term budget policy statement last month. And I might be wrong, but I don't recall him mentioning NHI. And I specifically recall in an interview that you and I did on the CRA channel early in the year, in February, he didn't mention the NHI there as well. So do you think that Treasury is basically giving us a signal here that they're not interested in costing this? It certainly doesn't seem that the National Health Department is interested in costing it. So is this all just a bit of a fantasy, a bit of a holiday from reality?
We might consider the whole thing to be the detachment from reality, but maybe we'll go with holiday. That sounds better. But I mean, that's a fundamental point. That it's like I think the country's fast getting to the point now where everyone's realizing that there's no free lunch anywhere. We're under a massive amount of pressure. The financial situation is certainly not great. The economy is not doing well, and now we have a bill before Parliament in which what it costs is being completely ignored, almost as if it's of no consequence. And I mean, it's bizarre and extreme, let alone maybe we could even say irresponsible. And I think, what's rightly now is that the opposition is starting to say to the finance minister, to Treasury, listen, guys, where's the financial feasibility analysis on this? But that in itself brings another point, is that nowhere in the bill process does it actually talk about what the NHI is going to cover and what it's not going to cover. So how do you cost something if you don't know what you're going to be providing? I think the analogy might be you're building a car. So we're going to build this nice car, but we have no idea what the cost of the materials are or what the design costs are going to be. But we're definitely going to build it. Don't worry, and the cost will be irrelevant. It doesn't make any sense.
Right, and there's no guarantee that all of those parts will actually fit together and operate and move that car forward in the way that it's intended to. It just seems very pie in the sky to me.
Yeah, and I think what's worth noting, with all respect to Treasury, is that the economic forecasts, their growth forecasts for quite a number of years now, have always been quite optimistic. They forecast X, and generally always comes in about 0.5%, maybe even closer to 1% lower than that. So, and I mean, even at the projected number of 1.6, I mean, there's just simply no ways anywhere in the fiscus any amount of money can be found. I mean, specifically if we go down the route of implementing the basic income grant on a permanent basis going forward, I mean, that in itself is going to add a huge amount to government expenditure. So where there can be anything else for additional funding out of the NHI, I don't know, it's anyone's guess, but certainly I have absolutely no idea where that's going to come from.
Yeah, and we mentioned Dr. Nicholas Crisp earlier, and he was complaining about the lack of available funding for healthcare. But as you pointed out to my colleague in a recent interview on the CRA channel, that was Chris Hutton, between the year 2000 and the year 2021, the availability of healthcare funding has actually doubled in that period. And it's now about 6 or 7% of the total budget expenditure. So that's already a pretty significant allocation and on par with the amount of funding that other developed and emerging markets set aside for healthcare.
Yeah, I know it's a very significant point. I think that we need to assess is one of the fundamental principles on which the policy process was argued that there was insufficient funding. Some of the comments from Zweli Mkhize, who was the previous health minister. I mean, he was categorically made a statement to Parliament that the reason that there were insufficient doctors in the public health sector is because the public sector budget hadn't increased in real terms for 10 years, but it's categorically incorrect. For the past 20 years, in real terms, in real per capita terms, the budget now is more than double what it was 20 years ago. So we've taken into account population growth, we've taken into account inflation. The public health spend just public health spending is double what it was 20 years ago. So, and that's resulted in also an increase in the number of staff employed by public sector. The number of filled posts has grown very substantially in the last 15, 16 years. There's a Treasury publication that they put out in 2017 showing that in preceding 10 years, so from 2006 to 2016, the number of filled medical posts, not administrative posts, medical posts increased by 43%. It's way in excess of what the population growth was for that period. So, and whilst I don't say that that's an absolutely sufficient number to run a first-class health system and give everybody the best amount of healthcare, we should at least in that period and up until now seen an improvement in health outcomes, an improvement in the quality of facilities, the quality of outcomes, but we're absolutely not seeing that. I mean, virtually on a daily basis, somewhere in the press, you'll find some statement about some, complete disaster in the health sector, in the public health sector. So the resource argument is fallacious. It is as simple as that. It just simply isn't true. The resources have increased. At the very least, we should be doing much better than we were 10, 15 years ago, but we're simply not. I was recently on a panel talk around the public sector health. And I mean, my sense of it, there were a few stakeholders, including government officials from the Department of Health and the unions, and there's quite a lot of antagonism between the two of them. One sort of blaming the other quite openly and categorically for all the problems. I do think that the one danger we need to avoid, and because I think this is exceptionally it's very unfair to label all public sector, with individuals, providers working, an enormous amount of people who absolutely do their utmost best. But it's the governance frameworks that have collapsed. It's the lack of accountability, an issue that gets virtually no airtime, but it has been highlighted by a number of both NGOs and academics, is the extent of moonlighting that takes place. This is where government officials or public health officials some years ago were given what's called the REWAP system, the remunerative work outside of public service, which is an official position that all medical personnel can perform a certain level of work outside of the public sector. So when they go into the private sector or anywhere else, and they get paid for that outside of that, but it's limited to the maximum amount, which is a small percentage of the overall work hours. But the evidence is showing that this has become endemic, and it's happening now on a wide scale where people are being paid by the state a salary, but spending most of their time working outside the state and elsewhere. Now, exactly how big this problem is, we don't know, because there's not really any sort of official analysis or understanding of it. But even at the scale that it is being reported, it must be at least a significant problem that is then causing these failures to say, well, supposedly we've got so many nurses in the system or so many doctors, but they're not physically actually there. So, but surely that at least warrants some feasibility assessment or some investigation on the part of government to say, how big is this problem? And, what's it contributing to the problems in the public sector?
Yeah, I mean, my colleagues at the IR have been campaigning quite hard against NHI. And one of the metaphors they use is that NHI will be the ESCOM of healthcare. And I think it's actually a very appropriate analogy, because, I mean, here what you have is this attempt to create this huge monopoly over a very complex sector with lots of moving parts that requires very kind of careful integration. But when you overlay all of the kind of typical governance problems that are associated with state-owned enterprises, with the misaligned incentives and the huge amounts of wastage that happens throughout supply chains, you can very quickly have a disastrous situation on your hands.
Yeah, well, absolutely, and I mean, it actually brings to mind. It was in the press. I think it was yesterday, or maybe the day before, that Ishmael Mamoniat, who was acting deputy DG in Treasury, has now been appointed as deputy DG. And he made a rather sort of blunt comment, but I think quite appropriate, to say that the problem with the deeply entrenched corruption in the state is that many times budgets are simply spent, or not spent on what they should be spent on, but they're simply stolen, if you like, before they go anywhere near service delivery. And I mean, we see numerous examples in the Department of Health of these problems. I mean, the horrific assassination last year of Babita Deokaram, where she uncovered 850 million rands worth of was flagged as suspicious payments. But that's from one hospital in a short space of time. 850, it's nearly R1 billion we're talking. I mean, that is not small change. We are talking a huge amount of money. Now, assuming all that money was, is lost to the system. In other words, it didn't buy anything that would be used in the. I mean, one of the items that we bought was jeans, denims. I mean, not quite sure where those get used inside a public health system, but those are the types of things that we see the evidence of all the time. Corruption Watch, which watches, obviously all in terms of that, has flagged numerous cases inside the Department of Health, and that these must be having an effect on service delivery. If money is going elsewhere, where it should be spent on consumables, remembering that health systems need a huge amount of materials, medicines, equipment, maintenance of equipment, maintenance of buildings. So there's not just personnel. It's not like an HR system, like where most money is spent on actual personnel. There's a lot of other things that are required as well. Well, that's where service failures will definitely happen if the money is just simply not there that should be there. For those services, for those additional items, medicines, materials, etc.
Thanks for watching. If you enjoyed this analysis, you might want to watch the full-length interview with Mike Settas. That's linked over here. You can also subscribe to my other channel for more longer conversations. That's linked over here. My name is David Ansara. Until next time, take care.